Can we say right now that we think the number of cases of skin cancer, there's an increase in the number of people being diagnosed with skin cancer? And if that's the case, why do you think that is? Is it better screenings, better detection, or is there another environmental factor that might be the case?
I think absolutely skin cancer is on the rise. I believe maybe 5 or 10 years ago, melanoma affected approximately 1 in 70 or 1 in 100 individuals, and now it's affecting almost 1 in 50. And I think that's because of the baby boomer generation, all those adults who in the 60s and 70s tanned, laid outside in the sun, weren't aware of sunscreen. If anything, may have used baby oil with betadine and mirrors to intensify the sun's effect. And then also, obviously, the use of tanning beds.
Yeah, I agree, but I would also say that because of more effective screening,
Yes.
probably it has resulted in a decrease in the number of advanced stage melanomas. So we are seeing more a trend towards early stage melanomas being detected, but late stage melanomas are becoming less common, and that chiefly has to do with better education, more use of sunscreen, more frequent emphasis on visiting a dermatologist.
And this is a good opportunity to remind all of our listeners that on May 23rd at 5 o'clock at the South Campus, there will be another skin cancer screening event. And so if you didn't have an opportunity to stop by today's event here at the North Campus at the Cancer Center, please mark down on your calendars May 23rd at 5 o'clock. And we hope to see you there. Blythe, do we have any other conversations?
I'll follow up with one last question from Twitter. If I do get a sunburn, what can I do to help my skin heal? I've heard people use aloe, lotion.
That is a dermatologist's nightmare question. Don't get the sunburn to begin with. Once you've done the damage, there's really very little that's actually going to affect the DNA that's been changed. I mean, at that point, once you've gotten the sunburn, obviously you can do common sense measures. You can apply aloe vera. You can keep the aloe vera gel in the fridge so it has a cooling effect. You can use petroleum jelly. Sometimes patients are actually having skin pain, and they can take anti-inflammatories. That sometimes can even help with the downstream cascade of DNA damage that's been in place, not in reversing that, but just in limiting some of that. But really the reality is we'd much prefer patients just avoid getting sunburnt to begin with.
Well, we'd like to thank both of our physicians, Dr. Priya Young and Dr. Bhatia, for participating in today's conversation about skin cancer and the screening that's happening here at the Community Health Network North Campus at the Cancer Center. It's still going to be going on for a little bit, so if you have an appointment, please make sure you keep it and stop by. If you haven't, then don't hesitate to think about going on May 23rd to the South Campus, where another screen cancer screening event will be held at that time. And thank you again for your participation this evening.
Thank you.